Hi everyone, it's Booney. I wanted to talk about this term called scope of practice and scope of competency. So when you're looking for a therapist, their scope of practice is to do therapy in terms of helping someone with their mental health, mental wellness, relationship problems. That's their scope of practice. They're legally allowed, ethically allowed to help you in these terms. Like a therapist wouldn't be allowed to help you with like finances or medical advice because that's not their scope of practice. They would have to refer out or say, it's not their scope. Someone else would be a better fit to talk about that stuff. And so in general, also, there's a lot of assumptions and confusions that people want therapists to offer advice. This is generally not the thing that therapists do. They can be more solution focused, where you as a client or consumer can have your individual strengths and brainstorm potential solutions or avenues to pursue. The caveat to that is if a therapist has a scope of competency in a certain area, like they're very familiar with like maternal mental health, like the foster system, addiction, neurodivergence, ADHD, all these things are different realms of competency. So not every therapist is going to be a good fit for you. They might have to refer to someone else or ask for consultation. So this is kind of tricky because like maybe your insurance has a limited list of referrals for you, or you're in a small town and there's like one therapist for the whole town. So if you need someone to have a more specific type of care in terms of psychotherapy services, this therapist might have to consult and receive additional trainings. And that might also kind of go into the realms of like, who are you allowed to seek help from, and what you expect as a client. So the expectation sometimes is that a therapist generally can just help me, period. And that is not the case. Sometimes they're not a good fit because even though they have the scope of practice to do therapy, their scope of competency is limited and they don't know well enough into your individual life circumstances to help you. So like I said in the way beginning about like marriage and family therapy, not every therapist is going to be good with couples. Not every therapist is going to be good with family systems or family therapy because they might not have the skill set to manage so many people in the room, or they just don't have the abilities to manage or they don't want to. Like some people are not very good at family systems as a whole. They could be really great individual therapists. They could be really great couples therapists. And so it's important to inform consumers of all the unique competencies and areas of focus that therapists can market. They can really show where they shine most. I think it's important to, when you're looking for a therapist, to look out for the keywords that you're looking for to make sure that you feel heard and seen. Like you won't have to over explain your story or your personal experiences. Like, yeah, this person sounds like they get me. Like their competency sounds very aligned to my personal experiences, and that will help alleviate so much of the stress or pressure to start over and explain from the beginning, because it's hard. Like there's trauma focused therapists, there's people who are more unique about relationships, people who can work with, for me, I would want to work on like neurodivergence, the differently wired experience, and I'm hoping to help cultivate that in terms of maybe children, women, singleness, like you can be happy and be single, and yet, relationally, we can talk about that as well. But in terms of like, different competencies, there's going to be a lot to look for. So it's going to be its own job to look for. But I'll list some on the bottom in the video description that you can look for people who, I'll just list some of them. Some people who are really good at trauma, like I said, sex therapy, eating disorders, addiction, men's mental health, the collectivist experience, like different from the individualist experience. So Asian American, Middle Eastern, BIPOC therapists, the racial experience is very different. So you might want to work on that. If that's something that has affected your mental wellness, you want to find someone who is familiar with that, someone who's an ally. LGBTQ experience, like if you're working on your sexual identity, or your gender experiences, like gender identity, like that's something that is very unique too. You don't want to go to just anyone. You want to go to someone who is going to be very compassionate, caring, and competent. Competency is important, so that's why that word is of utmost importance when you're looking for someone who can really help you. And some people who, like for me, with a background in education, academics, academic coaching, if you're looking for someone to really navigate the world in terms of your cognition, thinking differently, I might be a good fit for you in the future. It depends, because you have to find someone who's licensed or practicing in the state that you live in, and so that's very tricky as well. So I'll just throw that out. Competency was the topic of this video, but also the therapist has to be licensed or practicing in the state that you reside in, and that's kind of tricky. Not everyone who's the good fit for you is in the right state. And this is in terms of United States. I'm not sure how it works in any other country. So that's my blurb on scopes of practice, scopes of competency, and finding the good fit for you. I hope it helps. And if you're looking for someone who is a specific fit, I hope that all the directories I post could be a potential resource for you. Thanks for watching, everyone. Take care.